Assalamualaikum and hi everyone. In this video, we are going to discuss about impact of coronavirus. As we know, coronavirus gives a huge impact toward human mental health, economy and social. So, we would like to know about how coronavirus affect us and the country. Before we start, I would like to brief a little bit about what is coronavirus. The novel coronavirus infectious disease 2019, or also known as COVID-19, is a rapidly transmissible pneumonia-like disease which is caused by SARS-CoV-2. It is emerged in Wuhan, China during December 2019, and it is currently circulating throughout the world. So, without further ado, let's get started.
Assalamualaikum and hi, my name is Nur Najwa Amanina and I will be explaining more about COVID-19 in Malaysia. The first case of COVID-19 in Malaysia that has been reported was traced on 25 January 2020. It was from a passenger that tested positive for the virus after returning from China. Right after the first case, it is not the same anymore. The number of cases about COVID-19 has been rising to hundreds and thousands per day. As per the latest update, Malaysia has recorded over 5 million of COVID-19 cases with 30,892 active cases. Moving on to the treatment, the infected person with COVID-19 will be given an antiviral treatment, which will target the specific parts of the virus to stop it from multiplying and evolving in the body. It is also help the patient to prevent severe illness and death. These are the example of the antiviral that will be given to the COVID-19 patient. Some need to be taken orally and some by intravenous or IV infusion at the healthcare facility. However, there might be some side effect or interaction with other medications that the patient have been taking. To avoid that, patients need to consult with the healthcare provider first if the medications are suitable with them. In order to prevent COVID-19 from spreading maliciously amongst the public, there are some steps of prevention that we can take. First, we need to be up to date with the latest vaccine and booster. It is to get us immune from the virus, hence protecting the people around us. These are most importantly targeted to people with weak immune system. Next, we need to stay at our home if we are suspected or confirmed with COVID-19. It is to reduce the spread of infection to another person. Remember, our ego and selfishness might be the reason of someone's life threat. And lastly, we need to avoid contact with people who have been suspected with COVID-19. We need to be alert with the space between us since the virus can be transmitted easily.
I have 3 of my friends with me who are going to share about impact of coronavirus. Firstly, we are going to start with the social impact, which is going to be explained by Nur Fahana.
The COVID-19 pandemic in Malaysia has brought widespread social effect to the country due to the spread of the disease itself. Due to the high infection rate of COVID-19, the Malaysia government imposed an MCO from 18 March onwards. There are some limited activities due to COVID-19, including sport industry and education. The sudden outbreak of COVID-19 caused a crisis in society as well as in the sport industries. The disruption caused by COVID-19 led to the cancellation and postponement of many international sporting events. Like many sports organizations affected by the pandemic, athletes also have been impacted due to the restriction made by the government to control the outbreak. Athletes have had no choice but to focus on individualized home training sessions due to the hike in professional and recreational sporting activities. While the activities of the general public are also affected because they cannot go out to exercise and so on. The COVID-19 outbreak has impacted businesses of all sizes and industries. The education sector is no exception. All over the world, learning and teaching are rapidly being forced to move online. But this comes with some challenge, like coverage and speed of internet vary depending on one's budget and location. Especially those who reside in rural areas do not enjoy internet access of sufficiently good internet access, the way most of their peers who live in urban areas do. These students run a high risk of being left behind if classes are entirely conducted online.
What a great explanation from Nur Fahana. Yes, we cannot deny that coronavirus does affect human social in many ways. So, we would like to hear from another point of view from the health sector that is going to be explained by Anisha Mimi.
Assalamualaikum and hi, my name is Anisha Mimi and I will continue to discuss on the impact of COVID-19 on health sector. Before discussing on the impact of COVID-19 to health sector, let me briefly explain on what is health sector. Health sector is any place of employment where the primary function is the delivery of healthcare service, including everything that involves in protecting and also providing treatment for others, especially the patient. This sector involves the nurse, doctors, hospitals and also government of health. It plays an important role during the pandemic of COVID-19 and also known as frontliners. The first impact of COVID-19 in health sector is staff shortage, which is the lack of employees within an industry, commonly health sector, including the physician and also nurse. The increasing of COVID-19 case will also increase the numbers of staff needed for the health sector. The staff, including the nurse and doctors, are needed for the treatment of the patient that infected by the coronavirus. Then, it will also increase the job of opportunities. The increasing case and lack of staff will give the opportunities to people to get a job as a medical staff. This impact or situation also happen because there are a high number of depression and stress among the nurse and medical staff. This also happen because they need to handle the situation in a long period of time. The next impact of COVID-19 on health sector is medical facilities. The increasing number in cases will also increase the facilities needed, including the facilities for treatment. It includes the beds, the equipment and other facilities in the hospital. Lack of medical facilities commonly during the pandemic of COVID-19 will increase the rate of health fatality. This is because they do not have a proper and sufficient equipment and facilities to provide to the patient. There were also some viral videos during the pandemic of COVID-19 in 2019, which show a very crowded situation in a hospital. This situation should not be happening because this patient should be quarantined to prevent the transmission of coronavirus.
I am totally agree with your explanation, Anis. Health sector is affected indirectly or directly during COVID-19. Thank you for the great explanation. We have come to the end of the video. I hope all of the explanations are good enough for you to understand about how this disease affects us. Coronavirus caused a pandemic which has taught us that the world is connected. If we did not work together and cooperate, humanity will suffer drastically. We need to implement a few changes so that we not only emerge from this crisis but also able to continue with our life in a healthy and sustainable way. That's all from us. Thank you for watching.